Hi, we're going to talk about fungal pathogens now. And you remember fungi, they are eukaryotes like us. There are four um, primary fungus that cause disease in the United States. Of course, there's lots of other little ones, but the disease type of ones are these four: histoplasmosis, coccidiomycosis, blastomycosis, and cryptococcosis. And you can see by the map that the histoplasma is mostly on the eastern coast. Coccidiomycosis is in Arizona, Nevada, and California. And then the other two, blastomycosis, that's in Southern California-ish and up to Oregon. But the ones we're going to talk about kind of as representative are histoplasmosis and coccidiomycosis. Plus, we'll touch on another very common fungal pathogen. All right, so as I mentioned, currently fungal pathogens are uncommon. Histoplasma is one. Valley fever is also called coccidiomycosis, and ringworm is another very common one. So those are the ones that we're going to talk about. So first of all, I want to mention a new term, which is dimorphic, because fungi are oftentimes dimorphic, which means two forms or two, morph, is morph into something else. So dimorphic is to have two forms. So as you can see here, blastomycosis, coccidio, and histo in the environment, they all have hyphae, which are the long kind of spaghetti strands, if you will. But when they're in the host, they become a yeast-like organism. So they have, just a one single cell, and then they bud off a new cell from that. So they're kind of like, boom, another cell. So dimorphic, that's a new term. So let's talk about histoplasmosis. So histoplasmosis is caused by the fungus Histoplasma capsulatum. And this fungus lives primarily in the environment and especially in soil or areas that contain bird or bat droppings. They are carriers of that. And this is the most prevalent endemic mycosis in the United States. So what is mycosis? Mycosis means myco is fungal and is kind of like infection. So mycosis, it means a fungal infection. Histoplasmosis, as I mentioned, is mainly in the central and eastern parts of the United States. It's also in Central and South America, Africa, Asia, and Australia. So here is where histoplasmosis currently occurs. We saw the map earlier. It had kind of a bluish area. This is just another representation of the area it infects. So the Midwest and the East Coast down to Texas and Florida. So how do you get it? Well, you breathe in microscopic fungal spores from the air. A lot of people, most people don't get sick, but when you do, there are three main forms. The first one is acute primary. Acute meaning, comes on quick and is bad. Chronic means you have it a long time. And disseminated, that means throughout your entire body. So disseminated is not a good one. However, the frequency of getting any of these is not huge. So this chart is a little bit confusing, but basically let's start at the top. So asymptomatic, oops, this is coccidiomycosis, not my histoplasmosis. So skip this for now. So histoplasmosis, if you have an acute primary infection, it appears about 2 weeks, a week to 2 weeks after you inhale a spore. You get a fever, a cough, you're tired, you have a fever, a headache, you might have chest pains and body aches. This is an x-ray of someone who has histoplasmosis. You can see there is yeast inside, that x-ray. If we look at the x-ray, which is on the left, it looks kind of fuzzy inside. That is the fungus. And then if we look at the cross-section, we can see the actual dots of the fungus in there, the yeast form in there. So histoplasmosis, remember, is a yeast form when it is in the body, and it is a hyphae form outside the body. So the next type I mentioned was chronic cavitary infection. This is when pulmonary lesions resemble tuberculosis. So you get a worsening cough and you get dyspnea which is labored breathing or difficulty breathing. And this can actually be a disabling respiratory dysfunction. It doesn't disseminate it to your entire body, but it is in your lungs. And, it starts making these kind of like tubercles, like tuberculosis, just pockets of growing yeast inside. It can be very serious. And then we have progressive disseminated infection. And this occurs primarily in those that are immunocompromised. So someone who is getting cancer treatment, someone who's taking immunosuppressive drugs from transplant, a child who got a bone marrow transplant, also HIV, people who have HIV or actually who have AIDS. A lot of people have HIV and don't get sick. So it's more the AIDS function, the actual AIDS syndrome, if you will. All right, so what happens when you have progressive disseminated histoplasmosis? You get an enlarged liver, an enlarged spleen, and those make sense because those are kind of filtering your body of junk. You get an infection in your lymph nodes. Those two are kind of filtering your lymph, your body. You might also get an infection of your bone marrow, and that can be really bad. You might have oral or gastrointestinal ulcers, and you might also have just kind of the regular common symptoms of histoplasmosis: fever, fatigue, weight loss, not feeling good, headache, that kind of thing. And then two other forms that can occur with disseminated histoplasmosis are meningitis, which means infection of the meninges around the brain, sometimes into the spinal cord, or you can also actually get focal brain lesions. So just lesions in your brain that aren't necessarily a meningeal infection. And then you can also get severe pneumonia. Okay, not good. So histoplasmosis, here's what the spores look like in the environment, the upper part, and then they get into the body and they start infecting all kinds of places. And this, when you have disseminated histoplasmosis, you can also get something called petechiae. And petechiae those are raised red bumps on your skin. They could be from lots of different things, but typically they're kind of like a blood-filled blister, if you will. So how do we diagnose this? Well, we generally get a yeast. We get a sputum specimen or a tissue biopsy, and then we grow and see if, or we put it on something to grow it and see if anything grows. So if we do isolate the mold, the fungus in a culture, then that is a confirmative diagnosis. There are also some antigen tests to test for, the fungus, but of course this is, it's oftentimes very well buried. So sometimes those are difficult. So again, here's the dimorphic histoplasma capsulatum. You can see the hyphae with the sporangia. Those are the balls of spores on the left-hand side. And then we have the yeast form on the right-hand side. So how do we treat it? Well, a lot of people just recover on their own. It's, a lot of people don't have any symptoms. But if you do get the disseminated version, then the death rate's pretty high. But you can treat it, and you treat it with antifungals. Now, remember, fungus infections are eukaryotes. So we were able to treat bacterial infections with antibiotic, and those attack some of the things that us eukaryotes don't have, like cell walls or some of the energy producing functions of a bacterial cell that we don't have. So that's how antibiotics work. They work against a prokaryote, but we're eukaryotes. Fungus are eukaryotes, so we can't give really super strong treatments because it will be very toxic to us too. So we typically give low doses, and we give it for a long period of time. So in the case of histoplasmosis, it's like 3 months to a year. And that allows, it kills enough, and is not as toxic to our body. And then it allows our body to help rid itself of the fungus. So risk factors. Well, disturbing material near bird or bat droppings. So this can include a chicken coop, or if you're going spelunking and there's a lot of bats in the cave. So if you're cleaning your chicken coop, oh, I just mentioned these chicken coops and claves. Also, if you're cleaning, remodeling, or tearing down old buildings, sometimes they have like pigeon infestations or bat infestations, and those can be carriers for histoplasmosis. And so if there's spores floating around in the air, you can inhale them. If you're over 55 or if you're a young infant or immunocompromised, those three are all additional risk factors for getting histoplasmosis. So the next one we'll talk about is coccidiomycosis. Now this one's in our own backyard. So this one is one to not worry about, but watch out for. It's called San Joaquin Valley fever. And we live just north of San Joaquin Valley. We live in Sacramento Valley, but they're kind of connected. And this is a fungus called Coccidioides immitis. It lives in the soil, and it is present in Arizona, Nevada, Utah, New Mexico, California, Texas, Washington, pretty much dry states. Okay, so where it's not real moist. It's also present in Mexico, Central and South America. So here's just a graphic representation of where you might find it. You can see Arizona right there. I'm in Arizona right now. This is where my main house is, and you can see in Arizona the areas where it is kind of that dark reddish orange. That's where it's found most commonly. My neighbor across the street moved here. He retired here, and he got it. And he was from Colorado, never had ever heard of it before. And then he started having all these lung problems. And sure enough, he had coccidioidomycosis. He moved in and they were building a bunch of these houses. And so he just, the dust was flying and he got it. And you can see that these are case numbers per 100,000 in Arizona and actually in California as well. So in Maricopa, Pinal, and Pima County, you might have 100 people out of 100,000 who come down with it each year. And in California, it's much less. And you can see Kern, Tulare, Kings, and Fresno in the San Joaquin Valley are the ones that have the highest rates. And those can be really high. If you look at Kern, it's 612 to 1,300 per 100,000 people. So a significant problem there. And then when you get up into the Sacramento area, it's like, maybe 1 to 100, depending on the year. So it's still there, but not nearly as high as in the San Joaquin Valley. So coccidiomycosis, remember there's that mycosis again, is the disease form. And this grows in the soil as a mold with long filaments or hyphae. Then they break off into airborne spores when the soil is disturbed. This fungus spores are stirred into the air by anything that disrupts the soil. Like here's a good example here of a tractor plowing the field. Look at the dirt. Yep, it's all there. It's all going up. I mean, even if you're digging or, you're building a fence and you're digging, stuff out, or even if you're a kid and you're playing in the dirt, those are all places where the fungus lives and you could be exposed to it. This is what it looks like in the laboratory. It looks like a mold. It's very pretty, not very, but it's pretty white. And then you can see on the right-hand side, this is stained. So you can see the hyphae there. It's stained in blue. So most people are asymptomatic. Going back to that chart, I skipped over. It's like 60% of people who are exposed are asymptomatic. And you may only find out you've been infected if you have a skin test or blood test for it, or you might have an x-ray of your lungs at some point and they might see a nodule in there and they might say, we better take another look at that because it might look like cancer on an x-ray. And so they'll do a biopsy and then they're like, oh, you used to have cocci, but now you don't. So that's sometimes how people will find out about it. But if you do get it, if you're one of those souls who do get it, your initial or acute infection is fairly mild. And it's usually a week to 3 weeks after you've been exposed. You get the usual symptoms: fever, cough, tiredness, shortness of breath, headache, chills, night sweats, joint aches, muscle soreness, and you might get a red spotty rash on your lower legs, occasionally on your chest and your arms, maybe even your back. If you have chronic, if your initial infection doesn't resolve, it can progress to a chronic coccidiomycosis, which is a form of pneumonia. So signs include low-grade fever, weight loss, cough, chest pain, maybe blood-tinged sputum, nodules in the lungs. It sounds a lot like tuberculosis, doesn't it? It's very much like tuberculosis, only tuberculosis was a bacteria and coccidiomycosis is a fungus. This is a pair of lungs or a cross section of lungs after autopsy. This person had a very serious infection and did die from the infection. You can see just a huge amount of fungus that has taken over this person's lungs. That just would have been so almost impossible to breathe with. If you get it, you can also get a disseminated form. Let me back up. The pneumonia is only in about, maybe 5%, 10% at the long range of cases. Most cases are either asymptomatic or just very mild symptoms. And then you might get maybe 5 or 10% that are the chest, the pulmonary infection. And then there's another maybe 1% or 0.5% who go on to get this disseminated coccidiomycosis. And in this case, you may have nodules, ulcers, skin lesions, painful lesions on your skull, your spine, bones, any kind of bones. You'll likely have painful swollen joints, especially your knees or your ankle. And you could also get meningitis, which is that inflammation of the brain and spinal cord. The membrane surrounding the brain and spinal cord. And you can see on this poor person's leg, they have a pretty serious infection of nodules and ulcers. This is an X-ray of an X-ray and a skull from an actual person who died. And you can see where the arrows are on the left-hand side, image C. Those are the lesions on the brain that actually, actually on the skull, that actually kind of dug through that skull, if you can believe it. They just, the hyphae just kind of zoom in there. You can also see on the X-ray how diffuse the infection was in this particular patient. Lots of infection in their brain. So what are the risk factors? Well, if you work outside in a risk area, if you're over 60, if you have a weakened immune system, if you're pregnant, that's weakened immune system also. If you have diabetes, if you're a Filipino or African American heritage, those seem to be at a little more risk, not clearly understood why. But it does show up in Sacramento. As a matter of fact, there's pretty much only, there was pretty much only one physician who was working on coccidiomycosis. He was at UC Davis. His name was Dr. Papadopoulos, and he pretty much took in all the coccidiomycosis cases and diagnosed them throughout California. But anyway, if you are, in an area, if you live in an area like you do, or if you've recently traveled to Kern County, and if you have symptoms like that aren't improving, then that's when you want to seek medical care. Oftentimes you have a cold, you have a flu, but you'll get over those within a couple of weeks. But if it doesn't go away, go to the doctor. So how do we prevent it? Well, you can wear a mask when you're outdoors. That's a little bit impractical, although if I was farming, I would wear a mask and avoid very dusty areas like construction sites or farm sites that are plowing their fields. Stay inside during dust storms. That's common practice in Arizona. We get some really wild dust storms out here. And then if you're going to be digging in the dirt, then wet the soil down, and that'll help to keep the spores from popping up. And that's pretty much if you're at risk of infection. You can do it, it doesn't hurt, but that's just something to kind of look out for if someone in your home or whatever is at risk of infection. And during a dust storm, if it's really windy and you're down in Kern County, you would probably want to keep your doors and windows closed. No screens on that particular day. And then, of course, clean your skin injuries with soap and water, just kind of typical good hygiene. There is no vaccine, so, it's just up to us. Here's a dust storm from Arizona. Yeah, it's kind of wild, doesn't it? I've driven in one of those. Crazy. Kind of like valley fog. I used to drive in the fog over in Sacramento, and yeah, it's very similar. All right, so diagnosis is difficult. Remember, I told you there was just one physician who was really working on coccidiomycosis, and that was Dr. Papadopoulos. And it's difficult to diagnose this disease because it just doesn't really like to grow outside of the soil. But occasionally it can be isolated from sputum, either from a smear of the sputum where we look for we look for the fungus that's actually, growing in your sputum. And sometimes a culture will take sputum specimen and put it in some specialized media that will help it to grow, and we can see it then. And then you can also order chest x-rays if the person looks like they might have a pneumonia. And then tissue sample from the lungs for testing, blood test, check for antibodies. Also, there is, you can do spinal tap if you think they might have severe form where the meninges and stuff are infected, and got a great story about that. So I worked as a microbiologist for a billion years. And so I was looking at cultures one day, and typically when a physician expects something serious, they'll put a note on it when they order it, like hepatitis warning, like they think the patient has hepatitis. So then everybody's careful, of course, but and if there's a coccidiomycosis or histoplasma, they might write on the lab slip possible histoplasmosis, possible coccidiomycosis, whatever. Anyway, I am turning over my lab plates. Here we have a lab dish. We'll just call that a lab dish. And you turn them over, and this is the bottom. You turn them over and you look at them. Oh, what's growing there? Like, then you go to the next one. Oh, what's growing there? Well, I turned one over one day and I saw cocci on it. And my first thing was, because it frightened me, So what do you do when you're frightened? You take in a big giant breath. So yeah, that was really scary, because as soon as I did that, I was like, what the heck did I just do? So called my mom, my kids and we all went down to the ocean, spent several days down there to kind of just, in case I was going to die, thought we'd just spend a little extra time together. And luckily for me, I didn't die. But I've definitely learned my lesson when I'm looking at microbiology plates. If there's a spine culture you're looking at, yeah, just be really careful. Well, any kind of culture, obviously, but wish there had been a warning on it. And I did see the infectious disease doctor who was treating it and all of that, so it all worked out okay. But anyway, so coccidiomycosis, a lot of times they don't require treatment unless they're severe. They do give antifungal medications, which again, treat eukaryotes. Oral antifungals have serious side effects. Remember, these are eukaryotes, we're eukaryotes. And so anything that affects this fungus is going to affect us too. And that's where the side effects come in. So nausea, vomiting, stomach pain, diarrhea. And oftentimes these antifungals don't actually destroy the fungus. It's usually given, a long period of time, just like with histoplasmosis, and a lower dose to try and help the person recover on their own with just a little assistance from antifungals. But if you get it, you usually have lifelong immunity. Not always, but most cases you do have lifelong immunity. And even if you were asymptomatic and you had it, you will have lifelong immunity. Typically can be reactivated, but mostly that's when, like, if you go in and like you're older and you were diagnosed with cancer and you go and you have some radiation and they give you chemo and you don't have an immune system anymore, then that's when it typically gets reactivated. Okay, now one you might be familiar with. I'm sure you've heard of ringworm, right? Probably. Well, ringworm is basically caused by a fungus called tinea. And there's several different species, but in this case, most species are designated by who discovered them, or certain qualities that they have about them. But in this case, in case of tinea, the species is determined by where the tinea occurs on the body. So if you get it on your body, your arms, your legs, your trunk, it's called tinea corporis. If you get it as athlete's foot, it's called tinea pedis. If you get it, you have jock itch, down in the genital area, you have tinea cruris. If you get it on your scalp, it's called tinea capitis. And a nail infection is called tinium unguium. And all of those are very, very common. You know, we, it's just very common. That's all there is to it. So tinea corporis, red patches on the skin. Typically, they're in the shape of a ring, not always exactly, you know, perfectly round, but typically in a ring. They're usually scaly, itchy. You have inflamed skin, kind of the redness there. You can see a couple of maybe little raised bumps on that picture. And then it's usually a little redder right around the edge of it, and that's where the fungus is actively growing. So it's a little redder. Your immune system is attacking it there a little more. Go away. So a severe case may look like this. And that's where this person has not done anything about it for quite some time. Rings may multiply, grow in size, and actually combine. And then you get like giant lesions. And the rings may feel slightly raised. And of course, I mentioned the skin is likely to be itchy. And eventually you may get blisters and pus inside those sores because your immune system's really trying hard to get rid of it. So you don't want to get to that stage. Tinea capitis, again, it shows up typically on the scalp. All of these are treatable. Tinea unguium, that's the dermatophyte that grows. It looks like it's growing in your nail, but it's not growing in your nail. Where it's growing is the skin right under your nail bed. Okay, and so it's called a dermatophyte, and derma is skin. So it's growing underneath the nail and right at the nail, you know, junction, if you will, of the skin. It does turn the nail kind of thick and yellowish because the nail can't grow very fast because the dermatophyte there is preventing its growth. So it's just getting thicker and thicker and getting more colored because it's continually trying to grow, but it can't because of that dermatophyte there. Tinea pedis, athlete's foot, very common. And then how do we get any of these? Well, it's usually human to human contact, or it's human to animal contact. Dogs and cats easily get it, and humans get it easily from them. You can also get it from fomites, towels, clothing, bed linens, different combs, hairbrushes. So, you know, it's good not to share those. And then you can get it from the soil, but that's much less common because you have to be like in the soil or sitting on the soil or digging in the soil or something for quite a bit of time. It's much easier to get it because it's dispersed in there, right? It's not like when you touch an animal that has a ringworm thing on it and you're petting him and you're petting that round lesion, then you know you're getting it all over you. So how do we diagnose it? We do a skin examination. So we do what's called a skin scraping. It's taking a scalpel, but it's not going into your skin. It's just kind of scraping a few skin layers off the top. And then we put that on a microscope slide and then we look at it. And typically we can see what we see here, which is the hyphae that are growing, and we can see them under high power in the microscope. So treatment is easy. It's just over-the-counter fungal cream or lotion. You know, any drugstore has all of these. There's a couple of different ones, but they're all kind of based on clometris. How do I say that? Clotrimazole. I think that's right. I'm not sure about that one. But then infection, prevention of the infection, you want to avoid contact with infected animals or humans and avoid contact with infected objects. Usually you don't know what's infected, but you know, if it looks like it, stay away from it. Your lifetime risk of getting a dermatophyte infection is about 10 to 20%. So like I said, it's pretty common. You know, that's like 20% out of 100 people will get it. So if you don't get it, you'll know somebody who has it, who has athlete's foot or, you know, an infected nail or something. Here's a couple images of some puppies that have it. You can see the puppy on the left has it on its hindquarters, kind of a little red raised area. And when it first starts, the fur typically covers it, and then the fur gets, you know, what I want to say, it kind of sheds it can't grow in that area because the dermatophyte's growing there. You can see this a little bit more on the cat on the right-hand side, over by his or her eye. The fur is kind of sloughing off in most cases. So if your dog or your cat looks like it has a lesion, take it into the vet and get some treatment for it. And if you have one, get some treatment for it. It's not going to go away, and it's really easy to treat. So that's it for fungi. See you later for the helmets, which is ooh, icky. Perfect for the upcoming Halloween holiday, right? All right. Thanks so much.